Hello, and thank you so much for joining me today. My name is Chris Tucker. I am a Medicare insurance agent in the Arizona area, and today I want to be able to speak with you about what to know about Medicare for 2026. As a general disclaimer, this presentation is for educational purposes only. That means I am not going to be talking about any particular companies, any particular products as far as their specific copays or services, things like that. This presentation is only meant to inform you of possible changes to both Medicare Advantage, prescription drug plans, as well as standalone prescription drug plans for the 2026 year. So what is changing? For Part D, uh, which is the prescription drug portion of your Medicare plan, we're looking at an increase on the max out-of-pocket cost from $2,000 to $2,100. Now there's still no donut hole, and this $2,100 still goes off of the true max out-of-pocket cost. Now, what is a true max out-of-pocket cost? That is the cost that you have for your prescription drugs. Okay, so any copays that you pay, any coinsurance that you're paying, that is going through the plan that you're enrolled in. That will count toward that max out of pocket. Now, if you're taking prescriptions outside of the plan, such as maybe drugs from either like Mexico or Canada or other places outside of the plan, then that is not going to count. So even things like aspirin or vitamins, those are things that are not under that umbrella. Also keep in mind, per usual, the true max out of pocket also does not include your monthly prescription drug premium. And so that premium would be it is just an extra cost above and beyond. So when you're looking at standalone prescription drug plans, especially, I will have some clients who will say, well, I don't know if I want to enroll in this plan. It's cheaper or it doesn't have as high of a premium, but does that mean that the plan is really that good? And what I tell my clients is you have to look at it from a holistic standpoint. You have to look at, okay, how much am I paying in copays and coinsurance? And then if there's a premium, how much am I paying on that as well on top of it? Because that is your total out-of-pocket cost. That's what you're paying out of your bank account. And so I tell my clients the best you can always do is each year when the annual enrollment period comes up, look at what prescriptions you're taking, and then see how that projects into the next year, in this case, the 2026 year, and see what the cost would be. And that includes the premium. You know, if you can get onto a plan that has a lower premium and your copays, coinsurance, the cost of your drugs when you pick them up from the pharmacy is lower, then it makes sense to go with that plan. Now, the inverse is also true. I've had clients where they're paying $130 a month for their prescription premium, for their prescription drug premium. However, they are paying significantly low copays for their prescription drugs when they go to the pharmacist. And so, from a cost share or a total cost perspective, it makes complete sense. Also, the deductible for the prescription drug plans are changing from a possible maximum of $590 up to a possible maximum of $615. Now I say possible maximum because the government does not force the insurance companies to charge the maximum amount. They only give the limit. There are many insurance companies who offer a lower deductible. You may be in a plan that offers a lower deductible, and then also there are many insurance companies who, for especially tier 1 and tier 2 drugs, they may not even charge a deductible at all. And so be sure to look at your plan structure, look at that summary of benefits for your prescription drug plan, and it will go into detail on that for you. For Part B, B as in boy, this is the medical side, the hospital side of Medicare. The premium is going to increase from $185 to $206.20. This, in my time, this is one of the larger increases that have happened on the Part B premium, and so that is something to be aware of. Also, be mindful this premium will not increase until January 1st of 2026. And currently, as of the time of this recording, there is no word on the Part B deductible amount. And so I do expect it to increase. I don't know how much, of course, but I do expect it to increase as everything else seems to be increasing as well. But that is still out for now. All right, VBID is being discontinued. VBID is a fancy acronym for Value Based Insurance Design. And this was a separate bucket of money that the insurance companies could use to provide extra benefits for their Medicare Advantage plans or help with their prescription drug plan costs. And I'm going to show you kind of some of the examples of this. So, grocery allowances, we've got dental benefits, hearing allowances, vision benefits, over the counter. These are probably the most common extra benefits that individuals would use and the insurance companies would provide using this extra allowance, this extra money that they received. Now, with VBID going away, it does not mean that these benefits are also going away. Because again, as I was mentioning earlier, this bucket of money, this additional bucket, helped the insurance companies provide these benefits. It was not the sole source of income for these ancillary extras. And so, although I do not anticipate these benefits going away in Medicare Advantage plans, I do anticipate that there will be a reduction in these benefits. How much you're going to have. You're not probably going to have as much to spend over the counter. You're probably not going to have as large of a vision, dental, or hearing allowance, or even a grocery allowance. Okay. Also, on the prescription drug side, we're probably not going to see a lot of zero prescription drug cost sharing associated with plans. Maybe at tier one, we might still see some zeros as far as for copays, but you may see at tier two, all of a sudden, there may be a copay there for a couple dollars or maybe more. Again, that is because now this extra bucket of money is not accessible anymore for the insurance companies to help subsidize those costs. Also, SSBCI will still have many of these benefits available. SSBCI, another fancy acronym, stands for Special Supplemental Benefits for the Chronically Ill. What this means is that if you have a chronic condition that is considered chronic by CMS, which is the governing part of Medicare, that's what governs Medicare and these prescription drug plans, then you could actually qualify and get grocery allowances, additional dental benefits, over the counter, maybe even reduced cost share on your prescription drugs. That's because although VBID is going away, VBID was used for general public benefits. SSBCI is still a bucket of money that the insurance companies can tap into and will continue to tap into to be able to help them provide specialized care to those who have these different chronic conditions. Now, a couple examples of chronic conditions that would be covered are end-stage renal disease. You also have congestive heart failure, diabetes, chronic bronchitis. There's about another 15 roughly conditions that are considered chronic. And so I would encourage you, speak with your local agent if you feel like you have a chronic condition and you want to see if there is a plan in your area that you might be able to qualify for, or that you may be able to qualify for to be able to get these specialized benefits come the 2026 year. All right, big beautiful bill updates. There are a couple of things. One thing that's happening in the near future and another thing that's happening later. The thing that's happening in the near future is that Medicare supplements will begin a pilot on prior authorizations. So starting January 1st of 2026 and going till the end of 2031, there will be 7 states that will be part of this prior authorization pilot. And we just so happen to be, I say we as in Arizonans, just so happen to be in one of those pilot states. So the other pilot states are New Jersey, Ohio, Oklahoma, Texas, and Washington. And yes, that is 6 states, not 7. I apologize for misspeaking earlier on that. So if your plan is based on or based in those 6 states, then you could be required to have a prior authorization for certain procedures. I will put a link in the description of this video with the list of those procedures that CMS, again, the governing body that regulates Medicare and such, that CMS has outlined. So that way you can look at that. I will tell you that these procedures are very rarely done. And they are extremely expensive. Like one of them is a deep brain stimulation for essential tremor and Parkinson's disease. So you know, there's a lot of money that goes into that procedure, and that process and that treatment, and it's also very rarely done. And so the government wants to put some sort of a barrier on that, at least to ensure that the money being spent on that procedure is needful. And then we have a general reduced funding for Medicare overall that's going to start in 2027. So we've got the VBID going away, and then at the same time we have not at the same time, but then this following year for this next annual enrollment period, we're going to have reduced funding for Medicare overall. I don't know if this looks like a different structure to Medicare supplements. I don't know if it's going to look like a increase in copays or a further reduction in those extra benefits on Medicare Advantage, but just something to be aware of as the population of Medicare, more and more people are aging in, and more people are using the Medicare system than ever before. There is a noticeable strain, and with more and more people using their plan on a consistent basis to go visit the doctor, as they should, you know, these plans are going to focus more on being able to pay claims and make sure that they are staying solvent according to the rules and laws that they have to follow as an insurance company. And that's why you're going to probably see a reduction in those extra benefits, both this year and even possibly next year as well. All right, so tips for the annual enrollment period. So first of all, in this month, the time of my recording in September, be sure to keep an eye on your inbox. That's both your physical mailbox as well as your digital or email inbox. Be sure to be aware of any sort of annual notice of change, or as we like to call in the industry, an ANOC. This ANOC will tell you what changes are happening on your Medicare Advantage plan and or prescription drug plan for the next year. In this case, as the time of this recording, for 2026. It will tell you if there's changes in drug coverage, especially with your own drugs. It will let you know, hey, these are the tiers that your drugs are at for this year. If there are changes, it'll let you know what the next year is going to look like as well. So be mindful of formulary changes. This could be both whether or not a drug is covered, and then two, this could be whether a drug moves into a different tier. And then we've got the second one here, Medicare Advantage plans. They're going to have copays changes, as well as max out-of-pocket cost changes, or, as I talked about also, the third option there, ancillary benefit changes. That will also be in your annual notice of change. I would encourage you to review over those annual notice of change. That annual notice of change. Make sure you're aware of what changes are going on. Are you comfortable with those changes? That will help determine whether or not you need to talk with someone to be able to help you make a decision or make an adjustment. All right. And so this is the end of the presentation. If you have questions, my number and my email address are there. You are welcome to reach out to me. For those of you who are my clients who I sent this out to, this is part of my outreach during the month of September. I am working with my clients and also those, of course, who consider me their clients between September 1st and September 30th specifically to be able to get any updates to your prescription drugs as well as your doctors, or even maybe any conditions that you've developed over this year. The goal is by October the 1st, I have all that information together for you. And then from October 1st to October 14th, I will do plan comparisons to be able to see if, okay, is the plan you're in staying strong enough for you for 2026, or do we need to set up an appointment to be able to make a change? My goal each year is to be able to make sure that I do give you a call by or before October the 14th to set an appointment with you, or call you and I just let you know, hey, you're all good, no appointment needed, you're set for 2026. Again, if we do need to make an appointment, we'll definitely do that from October the 15th on to be able to get you taken care of and make sure that you're all ready for that. So either way, if you're a client of mine or you consider me your agent, then you won't have to worry about answering the phone calls, answering emails, or looking through your mailbox, trying to wonder, okay, is my plan still the right one for me? I can help take care of that for you. So thank you so much for watching. I hope you have a wonderful day. Look forward to being a blessing in your life, and we'll see you in the next one. Bye bye.